Welcome back to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. I'm your host, Colleen Sloan. I'm a PA, dietitian, and today we're digging into a hot topic, GLP-1 medications, weight management, and how high-quality protein like pork fits into the picture. So whether you're prescribing anti-obesity medications or supporting patients who are using them, you've probably noticed a shift in how people eat. These meds change hunger cues, food preferences, and how full someone feels, which means the foods they do choose matter more than ever. That's why in this episode, we're covering questions I know you've had in clinic, like how much protein is actually enough? What makes protein high quality, and why does that matter? How can we help patients preserve lean muscle while they lose weight, even if they don't feel hungry? And then where does pork fit, nutritionally, affordably, and practically, into this conversation? So whether you're helping patients hit their protein needs, trying to recommend affordable options, or just curious about how pork compares to chicken, tofu, or even protein powders, this episode has you covered with evidence-based insights, clinical talking points, and a few surprising facts that may change how you answer the question, can I eat pork and still be healthy? A huge thank you to the National Pork Board's Pork and Partners healthcare professional community for sponsoring today's episode and helping us reframe this often misunderstood protein. So to help us break it down, let me introduce you to my guests. Dr. Travis Masterson is a behavioral scientist and director of the Health, Ingestive Behavior, and Technology Lab at Penn State. His research focuses on food cue reactivity, food noise, and how our food environment shapes our food choices and eating behaviors. And Dr. Michelle Cardell is a registered dietitian, obesity researcher, and co-director of the Center for Integrative Cardiovascular and Metabolic Disease at the University of Florida. She's authored over 125 publications and is a fellow of the Obesity Society. Guys, I am so glad to chat with you today. So to kick things off, I would like to start with a quick refresher. So Michelle, can you explain how do GLP-1 medications work and what impact do they have on appetite, satiety, and metabolism?
GLP-1 medications like semaglutide or tirzepatide, which you might see branded as things like Wegovy, Ozempic, Mounjaro, or Zepbound, mimic the body's glucagon-like peptide 1 or GLP-1. It's a hormone that's released after eating that helps regulate blood sugar and appetite. So these hormones signal the brain, especially the hypothalamus, that you're full, which is going to help you reduce food intake. They also help to slow the rate at which food leaves the stomach. So this is why you hear GLP-1 medications help slow down gastric emptying. And this helps you feel satisfied longer after meals. So that combo of the slowed gastric emptying with the stronger fullness cues helps to reduce craving, snacking, and overall food consumption. Beyond just the appetite effects, GLP-1s improve insulin sensitivity and lower blood glucose levels. They seem to play a role in inflammation. And over time, these changes may help restore healthier energy balance and support that long-term weight management.
Yeah, and that long-term weight management is really important. But another key factor that we prioritize so much is preserving muscle mass. That's a major concern with our patients on GLP-1s. So Travis, why is protein intake, and especially the quality of that protein, so important here?
Yeah, so with any weight loss, you're going to see reductions in both body fat mass and muscle mass, right? So you're losing weight. Some of the muscle that's on your body is to help support you carrying around the weight of your body. And so as that goes down, you'll lose some of that muscle along with it. But one of the things that you can do to help preserve that is to have higher intakes of protein. So as you lose that weight, it'll come mostly from body fat and not the muscle mass going out. And to do that, you need to have high intakes of leucine. Leucine is an amino acid that triggers the muscle protein synthesis response in the muscle, very similar to exercise. And so having a high quality protein that's high in leucine can do that. Some of those high quality sources that have enough leucine in them to create that effect are going to be animal-based proteins, right? So when we're thinking about whey protein, which is high in leucine as a supplement, that's coming from animal products. It's coming from milk as a source, for example. But all meat products and a lot of animal products are going to have the correct amount of leucine to help promote muscle growth, as well as just being a high quality source of protein, meaning they have all the other amino acids that you need in the right ratios to help you build muscle.
Yeah, I want to linger here a little bit because we as health professionals throw around the terminology high quality protein a lot. And sometimes we don't necessarily know what that means. And our patients often don't know what that means. So, can you kind of dig in and nerd out with me a little bit on what the research shows? Like, what is high quality protein? What is that definition? And then how is it measured and defined within the research?
Yeah, high quality protein, it's really just that. It's that it has all the amino acids in particularly the essential or indispensable amino acids that your body needs. So some amino acids can be created or rearranged in your body fairly easily, but those essential ones can't. So you need to be bringing them in and in sufficient amounts, right? And so the source of your protein can matter. So, for example, when we look at plant sources of protein, they're usually deficient in a few of the essential amino acids. And so, if you're going to use plant sources, you have to get the right combinations of plants together. And that's not overly difficult to do. So, some people stretch it and say it's really hard to do. I don't think it's overly difficult to do, but you do have to be careful that you are getting that spread of amino acids. With animal products, though, they have that already. The other factor that we talk about with high quality is like the digestibility or usability of those proteins, right? And so animal proteins tend to just have a higher bioavailability, just meaning you can digest them more fully and more rapidly than those plant sources of protein. So that plays into like a little bit of like the convenience factor, the ease. So again, you can get those high quality proteins from a variety of sources. Just animal proteins tend to be easier and more convenient. So, for example, in weightlifting and bodybuilding, they tend to use whey protein isolates, right? Which are derived from milk products, usually like skim milk. And they do that because that whey protein has that wide range of amino acids and it also has the amount of leucine that you need. And so, usually with leucine, we're trying to target about 3 grams per meal of leucine. And so you can get that. With whey protein, the real benefit to weightlifters or bodybuilders, there's nothing special about the whey protein itself. It's just that it's convenient, right? So they're trying to pack in so many calories every day. It actually can become burdensome to eat that many calories. So they're using the supplement as a way to easily get that into their system. Whereas that might not be a problem for like the everyday person or somebody that's losing weight. It's preferable to get your protein from other sources like animal because of the food matrix that sits in, meaning just like the other things that go around that, like the carbohydrates, the vitamins, the minerals, those types of things that are going to also come in with that protein. Whereas in like a supplement, that's all isolated away and it's literally just the protein coming in.
Yeah, I think understanding high quality protein is important for health professionals, but then relaying that message to our patients is kind of where clinicians can feel stuck. And so, Michelle, I want to ask you some counseling tips here. What questions should we ask our patients to assess whether the patient's protein intake is sufficient?
You do want to assess overall dietary intake, not just understanding what the total grams of protein are that they're consuming, though we do want to understand that, but also to understand how they're fitting it in throughout their day. So, for example, many adults, especially women and older adults, tend to underconsume protein at breakfast and or lunch. But you also want to understand where their protein is coming from. Particularly for those on a GLP-1, I've seen a lot of patients who are getting a lot of their protein from things like whey protein, like Travis was speaking to. It's easy and convenient when they're experiencing food aversions. It can be an easy way to meet their nutritional targets. But as a dietitian, we really want patients to take a food first approach where possible, such that, you know, they're getting a mix of high quality options like lean pork, poultry, seafood, eggs, dairy, along with plant based proteins like beans, lentils, tofu, and tempeh that can also provide fiber and other nutrients. There is such a focus on protein right now, but other components are really important on a GLP-1 journey, like fiber, like ensuring enough hydration. You want to explore with the patients whether their protein intake is supporting their goals. So one way to do this, we like to recommend that patients consume at least 1 to 1.6 grams per kilogram body weight of protein. After you hit that 1.6 grams per kilogram body weight, there really is minimal return, and it does tend to displace other important nutrients. But ensuring that patients are getting adequate protein intake is not only going to support their weight management goals, it's going to help preserve lean mass, support satiety, and maintaining strength during that weight loss or aging process. And just thinking about these things holistically can help tailor recommendations that fit each patient's lifestyle and preferences in a personalized manner.
Yeah, nutrient adequacy is really, really important. We are so, as a society right now, hyper focused on like protein, 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 but we often forget the other nutrients that are really, really important. So, Travis, can you help us understand, especially for patients who are using a GLP-1, what nutrients does pork provide beyond protein that can help us maximize, their weight loss, but more importantly, their overall health?
Yeah, so one of the things that we're seeing with patients that are going on to GLP-1 medications are dietary changes, right? And we're still early days in terms of like what we're seeing and what's being reported. But some early papers have shown that patients are often deficient in vitamin D, K, B, magnesium, choline, and iron. And so those are kind of the things that we're looking out for. So there's a lot of sources of protein that will be good, and animal sources can be good sources of some of these things, particularly things like iron. So for example, pork is a complete protein that's helpful for maintaining that lean body mass like we were talking about. You get like 22 grams of protein for only about 122 calories, but it also provides key nutrients like vitamin B12, iron, and zinc. So some of these things that we're looking out for in our patients already.
I'm going to jump in here with a quick pork fact because pork is often misunderstood. So, did you know that a 3-ounce sirloin pork chop has less saturated fat and fewer calories than a 3-ounce serving of strip steak? Sirloin pork chops have nearly 90% more phosphorus than a plant based burger. And pork contains 2.2 times more vitamin B12 than chicken breast. Like Travis just said, it matters when we're trying to maintain energy, cognition, and red blood cell function, especially in our patients losing weight. So if you're curious how pork stacks up against other proteins like chicken, beef, tofu, or salmon, Pork and Partners put together an amazing resource called the Lean Pork Guide. I absolutely love it. It's linked down below in the show notes. You can download it completely for free. And then if you want to take a deeper dive into how different pork cuts fit into popular diets and how you talk about pork with your patients, go check out episode 109 titled, Is Pork More Nutritious Than You Think? You're going to love that episode after this one. All right, let's get back to the conversation. All right, Michelle, I love how you give us some talking points and counseling tips. As a dietitian, this is, your bread and butter. And so for providers who work in obesity medicine, what are some other talking points or scripts that might help when recommending animal proteins like pork to our patients who are trying to lose weight, but also maintain muscle?
You're going to want to lead talking about the science behind these things as well as satiety, explaining that protein helps people feel fuller for longer, that it's also going to help support that muscle preservation during weight loss, and that it can help slightly boost metabolism. Emphasizing that lean animal proteins like pork tenderloin, chicken, seafood, and eggs, as well as dairy, are nutrient-dense choices that fit well into a weight management plan. You also want to recommend lean options such as tenderloin, sirloin, loin chops, prepared in lighter ways like grilling, baking, or roasting. This is going to keep flavor high while keeping calories and saturated fat lower. You want to reassure patients that they don't need to choose between animal and plant proteins. Both can absolutely fit as part of a healthy and balanced diet. We want to encourage mixing those lean meats with things like beans, lentils, or veggies for balanced, satisfying meals that align with their goals and are going to help provide that fiber that's also going to be so important on a GLP-1 journey. As a clinician, you want to ensure that you're using supportive language that's non-stigmatizing. So framing recommendations around feeling strong and nourished, whereas we're trying to stay away from language that's more restrictive or focused on deprivation. So for example, saying things like including a lean protein like pork or fish at dinner time can help you feel satisfied, protect your muscle, and help you make healthy eating more enjoyable. That type of language is both inclusive and can be personalized based on what the patient needs, lifestyle are, and the goals that they want to achieve.
I like how we're always talking about variety and balance. And I especially love Pork and Partners pork and plants strategy. And so, Travis, I want to give our listeners just some tangible things that they can discuss with their patients when we're talking about including pork with plants. What are some plant foods that pair well with pork that support fullness and that nutrient density that we were talking about before?
When we're talking about fullness and satiety, like feeling full, what we're really looking at is getting people to eat a wide variety of foods that are going to be low in energy density. So what we're talking about is high volume of food with low calorie intake, right? So those are going to be things like fruits and vegetables. Fruits and vegetables have high levels of fiber, which is going to help with satiety, but they also have a lot of water incorporated into them with almost no fat. And so that gives them a lot of volume without increasing the calorie load. And so that's going to help you feel full. So people tend to eat about the same amount of food. Your body's really regulating around the amount rather than the calories, if that makes sense. And so the more you can pack in low calorie foods, the better. But the flip side of that is low calorie foods tend to not be super palatable. They're not very like tasty. So finding ways to increase that taste can be important. So some simple ways to do that is just through using herbs and spices rather than like fat and sugar when you're cooking your vegetables, like Michelle mentioned, but also cooking them alongside things like pork, for example. So we have some studies looking right now at how much pork should you include to increase the sensory properties of fruits and vegetables that are paired alongside those. So we have in our study, we're looking at pairings with high fiber foods like whole grain rice and pastas, sweet potatoes, carrots, spinach, mushrooms, those types of things.
I absolutely love, like I've said before, this pork and plant strategy and using pork as a flavor vehicle because it makes me think about Brussels sprouts. Like, I don't know really anybody who loves like plain boiled Brussels sprouts. They're very bitter. But if you throw some candied bacon crumbs on top of that, oh, that's a delicious dish. And that's a perfect example of how pork enhances flavor and acceptability of a lot of these veggies that we really want our patients to consume. Okay, but we need to talk cost. I feel like it's the elephant in the room. Inflation is real and rising costs of foods is a major concern for a lot of our patients. But pork is very unique in this aspect. So, Michelle, can you explain how pork compares to other proteins when it comes to affordability and accessibility?
Rising food costs can make it a bit more challenging to reach your protein goals. So, turning to things like lean pork, chicken, eggs, canned tuna, beans, and lentils, these all offer excellent nutritional options while still being more budget friendly. They deliver high quality protein along with key nutrients like iron, zinc, and B vitamins. Plus, these foods are widely available in most grocery stores and can be used in countless budget friendly meals from stir fries and tacos to soup, salads, and grain bowls. And choosing lean cuts like pork tenderloin or chicken breast and pairing with pantry staples like beans and lentils are going to keep meals nutrient dense and affordable. You also want to encourage your patients to get a mix of animal and plant proteins if they do eat animal proteins, and helping the patients meet their protein needs without overspending. So, affordable proteins make it easier to maintain an overall healthier eating pattern that's realistic over the long term. A modeling study examined the role of fresh pork in the revised Thrifty Food Plan. This provided a realistic cost estimate for achieving a healthy diet on a limited budget. And the study actually showed that fresh pork is a high-quality, nutrient-dense protein that fits into that lowest-cost healthy diet, meeting all of the nutrition requirements as well as dietary guidelines. The research also revealed that pork can fit into a nutritious diet at a lower cost, and selecting pork as a meat protein in that TFP reduced the weekly cost below the current cost levels. It also showed that selecting pork as a source of protein still allowed for nutrient adequate diets in the TFP. There were, however, some study limitations that we do need to go over. This was not an intervention or feeding studies, so results cannot be used to look at cause and effect. And while the results are promising, the eating plans that were modeled in the study featured pork, and this needs to be tested in reference to households to assess if they're feasible to follow, over the long term rather than just the short term. Also important to note that this research emphasized the value of fresh lean pork as a cost-effective option for families looking to eat healthy on a budget, but you would need to read the full publication in order to discover how pork can play a vital role in helping Americans of all ages eat healthy on a budget that actually works for them.
This is so fascinating, but I always bring it back to counseling and giving my listeners some really helpful practical tips they can use in clinic. Because let's be real, we are crunched for time. We have such limited time, unfortunately, with our patients to provide this excellent education. So I just would love to leave my listeners with one or two key nutrition talking points that they can prioritize about pork with their patients using GLP-1s.
So one of the things that you can tell your patients is to prioritize both protein and produce, meaning like whole fruits and vegetables. So you obviously want to target lean proteins, and we've been talking a lot about pork, but there's a variety, including poultry, fish, eggs, tofu, beans on top of that. And then fruits and vegetables at every meal. And that could be whatever is most appealing or comfortable for their patients to use. There's not going to be certain ones that are better than others, but what fits into their food, their family, their culture, those are all good. Getting that focus on protein, mixing these with whole fruits and vegetables is going to help to maintain muscle, promote fullness, and make sure they're getting nutrient adequacy while their appetite's reduced and they're taking in less calories overall.
And along those same lines, Travis, talking about those fruits and vegetables really highlights the importance of fiber in a balanced diet. Fiber is going to support digestive health, help manage blood sugar, and promote satiety, which are really important on GLP-1s. So as clinicians, we want to encourage our patients to eat a variety of fiber-rich foods like beans, lentils, berries, pears, avocados, like Travis was saying, whatever fruits and vegetables that you like, can access, and that fit within your family's lifestyle plan, as well as including whole grains to keep digestion regular and hunger steady. One thing that people often don't realize, they know that GLP-1s affect their appetite, but they can also affect patients' thirst signaling. So it can be difficult for patients to get enough hydration while on a GLP-1s. So definitely remind patients to stay hydrated when on these medications. They can use their urine color. If it's a pale yellow, that's a good indication that they're hydrating enough. But if patients want a clear recommendation of what they should be consuming, aiming for at minimum 8 cups of water daily, but ideally getting into more that 12 cups a day. And also, practicing mindful eating. On these medications, I find that patients, need to stop a little sooner than they think they do. So having them eat slowly and stop when comfortably full can help prevent some of those unwanted side effects like nausea, vomiting, constipation, and diarrhea. Because those GLP-1s slow gastric emptying, eating too quickly or having large portions can increase the risk of those unwanted side effects, particularly nausea or just overall GI discomfort.
Those are super helpful suggestions because when you're in clinic and limited for time, you can feel like, I don't really know what to talk about. Absolutely prioritize high quality protein like pork. Focus and ask about hydration. This is sometimes often forgotten. So hydration is a big one, Michelle. I'm really glad that you brought that up. and then using pork as that flavor vehicle to increase the amount of fiber and plants that the patient is consuming. Even if you can just suggest one of those things, your patient is going to be set to achieve their goals. All right, well, to close things out, I wanted to share with you guys how lean pork fits in the bigger picture of nutritious eating beyond just weight loss. And there's some facts that you may be surprised by, and I really was too. So here's what you might not know. Fresh pork today is leaner than it was decades ago. In fact, 8 different cuts now meet the USDA's definition of lean, and some, like pork tenderloin and sirloin pork chop, even go further and they're qualified as extra lean. But what does that mean? To earn that label, a 100-gram cooked serving must have less than 5 grams total fat, under 2 grams of saturated fat, and fewer than 95 milligrams of cholesterol. And yes, those cuts I just mentioned have also been awarded the American Heart Association's Heart Check certification. Now, let's not forget prep, because not all of our patients are chefs. So for fresh pork cuts, it must be cooked to an internal temperature of 145 degrees Fahrenheit, and then you follow that by a 3-minute rest. Remind your patients that it is perfectly safe and should have a slight blush of pink inside. Ground pork, however, should be cooked thoroughly to 160 degrees Fahrenheit. So if a patient asks you, can I still eat pork and be healthy? I hope this episode helps you confidently say yes, especially when it's lean, cooked properly, and balanced with a colorful, nutrient-rich plate. I want to give a huge thank you to you guys. Michelle and Travis, thank you so much for joining me to help us unpack how pork fits into a nutritious diet. Now, don't forget, you'll find links to all of the pork nutrition guides and handouts mentioned in today's episode right in the show notes below. And as always, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.